Focus on Abilities is brought to you by TIRR Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.
Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden. I'm your host for today's program. I'm a professor at the University of Texas Health Science Center at Houston, and I direct a program called Independent Living Research Utilization at TIRR Memorial Hermann Hospital. Today we've got two interesting guests for you, and I'll introduce them to you in a minute. But first I want to ask you a question, one that we'll answer before the end of today's program. We've heard a lot about brain injury in sports, and sports causes brain injuries sometime, but is that the only cause of brain injury? We'll be right back with the answer to that question and more on Focus on Abilities. Please stay tuned. Welcome back to Focus on Abilities, everyone. I'm Lex Frieden, your host, and today we have two very interesting guests on Focus on Abilities. First, let me introduce to you Joyce Leverenz. Joyce, welcome to Focus on Abilities.
Nice being here.
And in addition to Joyce, we're glad to have with us Maurice Farris. Maurice, we're happy to have you on Focus on Abilities.
I'm glad to be here. Thank you very much.
So, Joyce, you work at TIRR Memorial Hermann's Challenge Program, is that correct?
Correct.
And your job there is?
I have two responsibilities. One is, as a clinician, I'm actually a vocational counselor, so I help people go back to work after brain injuries. And then I'm also the clinical coordinator, so I have responsibility of overseeing program development and the daily operations of the program.
But given those jobs, it seems to me that the work you do actually with the patients must be the most rewarding.
Correct. That's what I spend the majority of my day doing. It's the part I enjoy the most.
And your training is as a vocational rehabilitation counselor.
I have a master's degree in rehabilitation counseling, which is the most common background for people that do vocational rehab.
And you've been doing this for a while. I mean, you have a lot of experience in that role.
Over 20 years.
And not only at TIRR, but also around the southeastern United States, I guess Mississippi and Galveston and other programs. So
correct.
You know how good the TIRR program is, right?
Yep, I was there originally as a vocational coordinator for 10 years and left to help start a program in Mississippi, and then I came back. So of course I love, being at TIRR. Well,
we're glad to have you in Houston. And Maurice, you have an interesting story. I know that you work at MD Anderson Hospital now, but I asked the question at the beginning of the show, is it possible to get a brain injury and not have a sports accident? You didn't have a sports accident, but you had the effective results of a brain injury, correct?
Yes, sir, I did. I initially I got sick over the course of a year of a brain injury called autoimmune encephalitis.
Autoimmune encephalitis. It's almost hard to say. Autoimmune means that I guess you don't have any resistance to it, correct?
That's right, sir. My own body attacked itself. So.
And encephalitis is a particular part of the neurologic system?
Yes, ma'am. Yes, sir. I'm sorry. It's a part of the brain. So it pretty much my brain had swelled up, and I had pretty much had inflammation on my brain that caused me to have seizures and also in the process be very confused.
So you were just at work one day and had a seizure, or what? How did these symptoms begin to manifest themselves?
Well, it first started off, I had problems with my speech. I couldn't talk clearly, and maybe after 2 weeks or so, I had very excruciating headaches that would last at hours at a time. And after maybe 3 months in the whole process, I started having very heavy seizures. So after a while, I was very, I guess, unambulatory. I couldn't really take care of myself, and I was very, very confused.
So, Maurice, this is over a period of months, correct?
That's right, it is.
And the seizures, how did you know you were having seizures? I mean, did you experience that viscerally, or how did you understand it?
I remember my first seizure I had. I was out with some family members, and I was at the dinner table, and I remember sitting there at the table, like, saying, man, my feet kind of hurt, So I was kind of like trying to unloosen my shoe a little bit, and all of a sudden my legs started to shake a little bit, and then of course I kicked back, and then next thing you know, I blacked out, and when I woke up, everybody was like, you just had a seizure. And I think nobody really didn't expect it, because still at that time it was unaware of what I was coming down with. I still was having the symptoms of problems with my speech, and also the headaches that would last all day long. I mean, I used to sleep from 8 o'clock in the morning to 6 o'clock in the evening. It was really, really
So, were you
painful.
taking Tylenol or aspirin or anything for the headaches, just treating yourself?
Oh, yeah. I was taking Tylenol like it was Skittles. It was like, almost the first thing at hand. I probably would take 3 a day, and then the next day I would take 4 a day. And then
Did the doctor tell you to do that, or you were obviously had a headache, so you went to the...
The doctor told me I could take 2 first, but we didn't know what was causing me to have these headaches. I was doing MRIs, EKGs, CAT scans, and everything came back negative.
So when you started to get the symptoms, you had the good sense to go to your doctor.
I sure did. I was going to the doctor like almost every day, and I was going to the emergency room like every weekend.
And the doctor was doing everything they knew to do to figure out what was wrong.
They sure was.
And you were getting worse.
I sure was.
How did it eventually, did you eventually pass out and they took you to the hospital, or what, you wound up in the hospital, or how did that?
When I had my first seizure, that's when everything started to pick up. I was in the hospital. Well, I was at the hospital at North Cyprus, and eventually that's when it began to progress more and more. I was, acting very strange. I was pretty much, kind of like, not aware of my surroundings. Everybody who was there trying to take care of me was also telling me that I was pretty much, acting like, I was very, very confused. I was pulling out my IV lines, and after a while, they had did a CAT scan that took 30 days, and it came back that I had autoimmune encephalitis.
But before that, they probably thought you were crazy.
They did. I actually was diagnosed with psychosis, and it was probably because of also, of my behavior that made them think that, I was...
Well, yeah, you're pulling out your IV lines and the whole deal.
Yeah, it was like something I couldn't even remember what I was doing, so it was pretty much something I totally was unaware of. But after a while, they did the CAT scan, and it came back that I had autoimmune encephalitis. And
so it took the CAT scan literally weeks or months after you started having symptoms.
Yes, sir, it did.
To finally help them diagnose what, in effect, you had.
Yes, sir, it did.
And I guess if they had taken it earlier, would they have known, or was it just advanced to the point where they could finally see it with this CAT scan?
Yeah, they would most definitely would have picked up on it earlier. Like I said, it was no telling, how they would have caught this. It was, a very few amount of people who really had an idea of what it possibly could be. But like I said, autoimmune encephalitis was one of them rare brain infections that most people hear about. So it was not like every day people talk about autoimmune encephalitis. So I was very, very lucky that my doctor caught it ahead of time so they could start curing me for it.
So it would have killed you.
It certainly would have.
You literally would have died had they not been able to diagnose it.
Most definitely.
Now, Joyce, this is an incredible story. Maurice went through a heck of a period of time where nobody knew. Family members, caregivers, nobody understood what was wrong. Does this happen often?
Not very often. We do see it from time to time. Like Maurice said, it's fairly rare. So we do see people in our program with encephalitis, but it's a different kind and it's caught a little earlier.
So most people that have brain injury, you know the cause of it. I mean, they bump their head. They
Correct.
they're in an auto accident or a sports accident, or they fall or they hit their head.
Correct.
They're athletes with concussions, and we can see the physical cause of the brain injury. In the case of somebody like Maurice, who has a cause that's not evident, are the symptoms the same? Is the physiology the same inside the brain? Does it cause the same kind of injury to the brain itself? And are the treatments the same?
There's some similarities. Across the board with brain injuries, we almost always see problems with short-term memory. Maurice also had some difficulty with kind of orientation and confusion, and that's not uncommon among all different types of brain injuries. Sometimes we see people with problems with moving, physical issues. He had some of those as well. So a lot of the symptoms that we saw when he started in our program are very similar to those that you see with people who've had traumatic brain injuries or strokes. So
but they would not have been sufficient to diagnose him, right?
Correct. As Maurice said, he was diagnosed with psychosis and was in and out of psychiatric hospitals throughout the summer of that year. And it was really in September of 2011 when he was finally diagnosed.
Maurice, did you have the sense when they were putting you in different kinds of hospitals and treating you for things, did you have the sense that they just didn't have it right, that wasn't the problem?
I didn't have a clue what was going on. I just woke up every day and I just most definitely felt out of place, but I couldn't tell you left from right, honestly. I was just very confused. I was very out of it. I knew I was in pain, but I would do stuff that you couldn't even think of. It was just like in my head when I'm going to get better, but I didn't even know where my home was.
Was your family worried about you in the sense that, well, obviously they were afraid they might lose you, but were you violent? Were you threatening to anybody in this state?
I wasn't violent, but I was very aggressive. They couldn't really take their eyes off of me. I would try to get up out of the bed. I would run. I wouldn't know where I was running. I was strapped to a hospital bed at a period of time because I was just, too strong to stay in my bed without no supervision. So I would say that I needed some special attention at certain times.
That's an incredible story. Now, Maurice, you were employed at the time.
Yes, ma'am.
All this happened. This was, you were working in what job?
I was working at MD Anderson as a bone marrow technician.
So every day, how long had you been doing that job?
I was a bone marrow technician for about 12 months.
But you were also going to school at the same time?
Yes, sir, I was.
Studying?
Nursing.
Okay. Well, I want to visit with you more about your experience, and Joyce, we want to learn more about the kind of rehabilitation that somebody with this kind of injury, illness, brain injury might have. But first, we're going to take a break. Please stay tuned. There will be more Focus on Abilities coming right up after this break. Welcome back to Focus on Abilities. I'm your host, Lex Frieden, and we're here today with two interesting guests, Joyce Leverenz from TIRR Memorial Hermann and Maurice Farris, who works at MD Anderson Hospital. But Maurice, you consider yourself to be a survivor, don't you?
I sure do. Thank you.
And a survivor of what at one point in your life was an unknown illness, right?
Yes, sir, it was.
How would you describe overall the experience you had experiencing the symptoms and then being diagnosed and going through rehabilitation?
Well, I would say it was most definitely an emotional battle. It was very tough to deal with the whole process, especially acknowledging after I figured out what was going on, because, for a long time I did not understand what just happened. It really took a toll on me for a long time. I mean, I was having days where I was just very depressed, trying to figure out when it's going to get better. If, anybody else been in my shoes and have they got better from what I just came from, because, being so young, I never ever heard of autoimmune encephalitis. And, it just felt like, the walls were closing in on me. And I just felt like, after all that, I really did accomplish a whole lot with the therapy, and especially with family being on my side and stuff.
That's a great attitude. Maurice, how old were you when you first experienced the symptoms?
I was 22 years old.
And employed, living at home with your family? Where?
I was living with my fiance at the time.
Wow.
And after all that, I pretty much had my family members step in, and I've been staying with my parents through the whole process, and it really helped me out after a while, because I had wrecked my vehicle when I was having one of these problems, and I also had to go stay with my parents because I had lost my job, and it was really, really tough for me to pay any other bills, especially because I didn't have no kind of, I was also in the hospital like all the time, so I really didn't have no kind of income.
And your fiance, she probably didn't know what to do.
Oh, it was tough for her too. I mean, we were both young, so I mean, we didn't even know if I was going to survive from this. So for her, I think it took an emotional toll on her too, because I just saw her at a totally different stage where she was very worried. So my heart really goes out to her.
You still friends with her?
I am. Yes, I am. And I really felt like, it really rocked both of us up, because she saw me go through the whole process, and before, you really never saw a sick bone in my body. So it was weird, So watching me go from a very strong, healthy person to, this guy who can't even get out of bed every day. So yeah, it really took.
And Maurice, from the time that you experienced your first headache, or you first noticed that your speech was slurred, until the time that you felt like you got into the rehabilitation program and made progress, how long was that? Was that a year or 2 years?
When I got into the program, I noticed my speech was kind of slurred. Like my thinking level wasn't, up to par. I really didn't know how bad it was until I really got to speech therapy. And, at the same time, I'm still on a lot of heavy medication. So I'm getting the education as I go, but I'm also getting my understanding back. And it was really I would say maybe almost 2 months into the program, I was like, okay, man, I really have a problem with my speech. How I'm gonna really get back out in the world and talk the way I'm talking.
So before that, though, how many months were you sick? How many months?
I was sick about 3 months. Okay. That I knew for sure I was really not with it.
So everything happened over the course of a year, over the summer, and then you evidently, your doctor referred you to the brain injury program at TIRR.
Yes, sir.
And Joyce, you get these referrals from physicians, and they come with a note saying what the physician has diagnosed as the problem, and then it's your job to work with the patient to figure out what kind of a rehabilitation program is going to be helpful to them, right?
Correct. And in Maurice's case, it was 2 phases. The first he's talked about quite succinctly, which is the helping him become aware of that something has happened and it's affected his thinking. By the time he got to us, which was the beginning of 2012, he was already walking and had issues with endurance, but was ambulatory. So our focus was on helping him become aware of the cognitive problems, which was mainly short-term memory, and then teaching him and his family strategies so that he could be more independent with taking care of his own medications, taking care of things around the house so that he had some productivity while he was still having some recovery.
So, Maurice, we talk about recovery, but recovery has to start somewhere.
Yes,
Now,
sir.
I guess it probably started in your mind when you figured out what it was causing all these problems, right? But how did they treat that? Was it just medication at that point, or do we know? Is this like a virus? Is it gone now, or what's the story on that?
Well, you know, initially they did start it with medication. I was sent home with prescribed medication that I would take, you know, maybe 3 times a day, you know. And then the second step was course therapy. I really didn't understand, you know, what I needed therapy for until I got there. And it was like, you know, I didn't know if it was a long-term therapy, short-term therapy, but I most definitely thought it was a lifetime when I got there, because I really felt like I had so much I need to improve on. And I always see like people who have brain injuries, but you know, never really saw anybody with autoimmune encephalitis. So it was like, you know, is I'm, you know, lifetime impaired, or you know, or I'm short term. So.
And you still don't know, right?
You know, I always guess will I ever be back to normal, but you know, I was told that you'll never be back to normal, but you can always improve. You know.
So is there a chance that this autoimmune virus will attack you again?
It's very rare. I was told that it will never come back, but you know, anything can happen.
But so they don't have a vaccine. I mean, they didn't kill the virus. It just ran its course,
Yes,
basically,
that's right.
and during the process. But Joyce, I'm a little confused about this. That virus would have most likely killed Maurice if they hadn't done something to arrest it or to moderate its effect, right?
Correct. He had medication treatment, a lot with steroids to keep down the swelling. I don't, because that was several months before he got to us, I don't know what other medications they used, but I'm sure something just to let it run its course so that he wouldn't worsen. But it wasn't, and he did not have encephalitis when he got to us. He just had the effects of having had it for so long, particularly with the cognitive areas that he had.
But for
trouble
people
with.
who don't understand it, what happened really is he had swelling in his brain, swelling in certain parts of the neurophysiology that caused all of these symptoms.
Correct.
And had Maurice, if you hadn't had the steroids and some of the other medication they gave you, that swelling would have eventually killed you. And the swelling itself, the longer it lasted, the more damage it was probably causing.
Correct.
Certainly.
And your experience then, at this point in time, is simply to recover what functions were injured by the brain that was damaged in the course of that viral experience, right?
Yes, sir, it is.
And the symptoms that you have, you're overcoming through therapy. Joyce, how long will Maurice's therapy last? The rest of his life?
He actually has finished the official rehabilitation. The first phase was what we talked about. The second phase was, as he improved, we always felt that Maurice could go back to work. And we also know that when people go back to work, their symptoms improve.
Huh.
Just by being at work, just by having activity, we see people recover.
So how did that happen? I mean, you're coaching him and providing him with therapy and talking to him about going back to work, and then do you call the employer? Does he contact the employer?
It was both of us. Maurice did all the legwork, and we supported him through the process. He applied for a different position. You know, the good thing is that MD Anderson was very supportive. They knew what had happened to him. It was known. So we, and I worked with his supervisor when he got the position, educated them about the memory strategies that worked best with him. And he no longer needs to use those memory strategies 6 months after working already. It was only the first couple of months. And I would check on him at work and make sure things were going smoothly. Couple issues that came up, but we got those taken care of very early on, so that
Maurice, are you doing the same job you did before you had this episode?
No, sir. Now I'm working as a CNA, and it was just kind of like something temporary until I go back to school and further my education.
Okay, so you don't necessarily want to go back to the tech job you were doing at first. Your goal even then was to further your education, get in more direct patient care, right?
Yes, sir, it was.
So you got your CNA license in the process of this recovery?
Well, I had my CNA license before.
Okay, you're just applying that certificate and doing
Yes,
the
sir.
work on the floor.
Yes, I am.
You feel good when you're at work?
I really do. Being so long out of work, and especially since I've been working at such a young age, is really compromising. I really feel like I haven't been at work for so long, and when I'm there, it's like I've completed one of my goals at the therapy, and I have so many more goals that I want to complete.
So what would you say to a young person who had some life-changing experience, injury or an illness that changed the course of their life and became a real challenge to them at a young age? What would you say to them?
I'll just personally tell them that, it's not the end of the world. With the right therapy, anybody can overcome the stepping stone that you're going through. It's most definitely not over.
And you realize your life will be different, but it's still something to look forward to, right?
It certainly is. You have, pretty much, I would say, more, courage. It gives you more strength. Whatever didn't really kill you, it made you stronger.
Okay. Joyce, the important aspects here are individual will. Maurice demonstrated that. Family support.
Absolutely.
Good physicians and caregivers.
Absolutely.
And employers who really want to make people work in the workplace, right?
Correct. Everyone was supportive along the way, which makes it much easier.
We appreciate you, Joyce. Thank you for being here today.
Thanks. I love
And
being here.
Maurice, thanks a lot for being our guest today.
Thank you very much, sir.
Good luck to you in the future. I want to thank all of you folks for watching Focus on Abilities. We've had a great program. I'm Lex Frieden, your host. I want to thank HTV, want to thank our sponsors, and want to ask you to join us again for Focus on Abilities next time. We'll see you later.
Focus on Abilities is brought to you by TIRR Memorial Hermann, redefining rehabilitation, removing barriers, re-enabling independence. In the ILRU Southwest ADA Center, promoting compliance with the Americans with Disabilities Act.